I'm back, baby! Okay, in all seriousness, today we're going to be talking about what physical therapy is, what it can do for you, where do we work, education involved, and what does a good physical therapist look like. Stay tuned, we've got some good stuff today just to fill you in and answer all those questions. So before I get started, my name is Mark. I am a doctor of physical therapy. I am one half of Mobility Duo with my wife, who is a yoga instructor, personal trainer, a massage therapist, lots of things. We are athletes, working primarily with snow athletes and weekend warriors, providing you with all that wonderful information for prehab, rehab, strengthening, flexibility, mobility. You got it. We're slinging it out there. So welcome. We appreciate subscribing. We work hard on these videos, and let's get started. So first question, what is physical therapy? So let's look at the name and break it down. We have the physical aspect and then we have the therapy aspect. So physical aspect is physical therapists generally are experts in the muscles and the skeletons of the body. This can also kind of overlap into the neuro realm. There is a lot of neuro involved, especially with muscles and activation and all that good stuff. But it's very, very well rounded. So then you have the therapy aspect of it. So therapy, as I see it, is kind of guiding someone in their rehab process. This could be physically, this could be mentally. Usually it's a mixture of both. So you have the physical and the therapy aspect. So that's kind of how I define a physical therapist, someone who will guide you in your rehabilitation process, whatever that may be. That could be a sports injury, that could be a neural injury, that could be an assisted facility, rehab facility. So it's very, very broad. So where do physical therapists work? This is a great question, and it is very, very broad. So the first thing I will kind of note as a physical therapist, being an outpatient physical therapist myself, I work in the standard clinic that you see driving down the road that says physical therapy. You walk in with a sprained ankle or something like that, and then you see someone like myself who will kind of guide you in that process. So that's the first one. Physical therapists are found in schools, working in the school districts for children with special needs. They're found in assisted living facilities, skilled nursing, hospitals. That could be the acute setting, that could be the ICU, that could be, now you're seeing a lot of people in the emergency department for, if you come in, say something goes wrong, you go to the emergency urgent care. They're now putting physical therapists in that setting for musculoskeletal stuff. You'll see them in a neuro setting, like an outpatient or inpatient neuro that works with them intensely for up to 3 hours a day. You'll see them like on a sports team. You're seeing a lot of these physical therapists now that work simultaneously with athletic trainers, with sports scientists. Let me think if there's anything else I'm missing. I know there is, but that just gives you an idea kind of the variety of what physical therapists can do. And now you're seeing a lot of them move into leadership roles in hospitals, consulting, as well as teaching roles, because it is a doctorate. So yeah, it's pretty cool. Okay, education. Education is a very important piece of physical therapy. As you may or may not already know, physical therapists it takes up to 7 years to get a physical therapy doctorate degree. It is a doctorate. No, we are not medical doctors, so we cannot prescribe medication, but we are a doctorate degree, doctors of physical therapy. So it's 4 years of a bachelor's degree plus 3 years of additional grad school. They do have programs that do 3+3, but those are a little bit smaller, more selective. So just know that when you see a physical therapist, you are in good hands, someone who is well trained, someone who's well educated, and ideally should have a good knowledge of the human body anatomy. Okay, so the good stuff. What can a physical therapist do for you in your rehab process? So I can only speak for myself. We're currently working in an outpatient or a brick and mortar physical therapy clinic that you walk into on the street. So essentially what can they do for you? So what we do know through research is exercise is good. There are so many benefits to that, and that has been proven already. So what a good physical therapist will do is they'll guide you in your rehab process. So say you come in with a sprained ankle, they know the right exercises to do, they know what you should be doing to not only expedite your rehab process, but make you a better version of yourself, make you stronger prior to when you came in. They may apply some manual treatment if it is called for. They should be doing a lot of strengthening exercises. They may work on your balance. They may work on mobility. What they should be doing is finding those weaknesses and deficiencies and giving you appropriate exercises to, again, become a better version of yourself before you came in. So, all right. Lastly, what does a good physical therapist look like? Now, I don't want to make it black and white. I don't want to say this is what a good physical therapist is based on these things, and this is what a bad physical therapist is based on these things, because it just doesn't work like that. What I can say and speak for in the outpatient realm is, like I mentioned before, a good physical therapist will treat you as the person. They will not treat the diagnosis. Now, what that means is if you come in and the doctor says, the MD or the DO says, this is what I think is going on, the physical therapist will take that to heart, but they will do their special testing. They will base what they see on what they've experienced in the past, and they will make that decision based on the test results that they find, the weaknesses, the deficiencies, and they'll move on and build from that. If they're basing all that stuff off of what another person says, that's not a good physical therapist. So again, they will treat what they see, the deficiencies. They will not treat the diagnosis. So that's the first aspect of a good physical therapist. The second is they will listen. A good physical therapist listens to the patient. So what we do know in regards to the rehab process and pain specifically is it's very, very complex. There's multiple sides to that. So they're going to listen to the patient. So what you're seeing a lot now these days with outpatient physical therapy is kind of a corporate model. And what that means is you might come into the physical therapy clinic, you might be seen with 2 or 3 other patients. And it's an unfortunate process. It's no fault of the physical therapists themselves. And unfortunately, they can't spend as much time with you as they would like, or they hand you off to an assistant, which, usually assistants are also great employees, but in regards to getting the best, most up-to-date information, you'd probably want to work with a physical therapist themselves. So again, it's no fault of the physical therapists themselves, but you as a patient have a choice. There are clinics that are seen one-on-one. You can attend a hospital, which is one-on-one. Just know that you as a patient have a choice to see and choose different clinics that have that as an option. Okay, so now you know what a physical therapist is, the education involved, what we can do to help you, and what a good physical therapist looks like. It comes back to us, Mobility Duo, my wife Sarah and I. We now offer our services online or in person, so give us a shout out if you have any concerns, questions. We're always happy to answer questions for free, and maybe we can help you out. We do online coaching, we do online kind of mobility, movement sessions just to see how you move, and there's a chance that we can help you out. So let us know. Let us know if you've had a good or bad experience with a physical therapist. We'd love to hear that as well. Again, give us a subscribe. We really appreciate it. Show us some love. And yes, we will see you next time.